Hi everybody, this is Giuseppe Argenziano from Naples, Italy, and I would like to share with you a very special case we recently had in our dermatologic ambulatory. This lady, she's a 75-year-old woman, and she came in our general dermatology service for a long-standing problem on her scalp. As you can see from the clinical pictures, she's suffering from erythema and hyperkeratosis on her scalp, and she has been treated since many years for a varieties of dermatologic conditions. This condition was first diagnosed as psoriasis and of course treated as in the context of scalp psoriasis. Then the diagnosis changed into folliculitis decalvans, and therefore she was treated also with antibiotics, and then again a third diagnosis was lichen planopilaris, and therefore she was treated accordingly. But none of the treatment that she performed in the last few years was beneficial, and the condition was worsening and worsening. As you can see, there are very thick hyperkeratotic crusts on her scalp, and there is scarring alopecia as well, of the scalp. But the situation was extremely difficult to assess clinically. But since we have our dermatoscope, and we know that in some cases, especially on the scalp, for general dermatology, for inflammatory skin conditions, infectious skin conditions, our dermatoscope could be helpful, as well as in the context of pigmented lesions. We used it, and we found a very interesting sign that you can see outlined by the red square, and this is called the barcode sign. So you can see that one of the air shafts are interrupted by white lines, and this means that this could be a microscopic tinea, microsporic tinea, because this is very typical when the hair shaft is colonized by the Microsporum canis. So this was the reason why we performed a microscopic examination of the scales, and immediately we found out the dermatophytes, and therefore we started the treatment with antimycotic agents, and immediately she found relief finally from this long-standing hair condition. So as you can see, dermoscopy is not only useful in our practice for skin cancer, for melanoma, for pigmented lesions, for basal cell and squamous cell carcinoma, but it's also relevant, heavily and incredibly relevant for the diagnosis of inflammatory skin conditions and for infectious skin conditions. So please use it more and more in your practice. So thank you, and bye-bye.